Hey, what's up, guys? Welcome back to the nursing channel. I'm Nurse Sam, and I want to talk to you guys about things you need to know before deciding to become a nurse. So, if you are thinking or contemplating about becoming a registered nurse or even an LVN or just any type of nurse, you need to watch this video first. And for many of my subscribers, I know I haven't made a video in a long time, but I promise you guys I'm back and I'm gonna start putting out more content. So the topic is things you need to know before deciding to become a nurse. And I'm gonna make this very brief. I'm not gonna spend too much time talking about this, but I'm gonna give you guys some important information that you'll need to know before deciding to become a nurse, okay? One of the things I wished I would have knew before deciding to become a nurse is that nursing school is going to be tough. Nursing school is going to require all of your time, okay? You need to really be dedicated and not allow for any outside distractions. For example, me, when I was in nursing school, I made sure I wasn't dating or allowing anybody to be able to distract me from my goal, which was graduating from nursing school, okay? I had many opportunities where girls were trying to get my attention and wanted to date me, but I said, nope, I can't, because I know myself and I know how easily I can get distracted, especially with women. And so I decided to block that out and not be in a relationship during the time I was in nursing school. And I'm glad I did that because, I was able to get to nursing school, and nursing school just required every second of my time. Like I would have friends inviting me to go out. Let's go to the movies. Let's go get something to eat. Let's go out and grab some drinks. And I said, nope, I can't do that. I'm studying tonight. I have an exam in 1 week. So that's the type of person you have to be when you're in nursing school. So if you're deciding to become a nurse and go through the nursing program, just know that you really need to be dedicated and focused. Okay. The other thing is you need to know that nursing school is going to be way tougher than the prerequisite classes that you're taking. When I was taking like anatomy and physiology and microbiology and chemistry, which are the prerequisites to get into the nursing program, I thought these classes were so tough. I was like, there's no way that the nursing program can be harder than anatomy, physiology, and chemistry and microbiology. But guess what? Nursing school is way tougher than that. So just know, guys, that you're gonna have to bring your study skills up a notch, because nursing school is a lot tougher than the prerequisites. Don't think it's gonna be easier, okay? Because I know when I was taking like anatomy and physio, I was like, this is super tough. This is hard. I'm gonna breeze through nursing school because I know nursing school can be harder than these classes, and I was completely wrong. Okay. The other thing is, nursing school is hard to get into. Okay, it's very competitive. A lot of people nowadays, when you ask them, what's your career choice or what are you studying to become, and everybody says, I want to become a registered nurse. Okay, so a lot of schools are impacted, and it's really hard to get into the RN program. Okay, so just know that. So when you're applying to various schools, make sure that you go with the first school that accepts you, because it's not going to be promised that other schools will want to get you. So go with whichever school is willing to accept you. Even though it's expensive, even though the nursing program could be $100,000 or $150,000, which is ridiculous, but just go with that program, go through the schooling, because once you graduate and you start working as a registered nurse, you're going to be able to pay off your loans very quickly, because you'll be making really good money. In California, most RNs are making easily 6 figures, okay? And I'm saying that speaking from experience, okay? As a new grad RN, you're going to be making good money, and as you get more experience, you're going to have more opportunities to make even more money. So just don't worry about how expensive your tuition is for nursing school, okay? The other thing is, just because just because you're when you graduate and you become a registered nurse, just because you're an RN, doesn't mean you have to work at the bedside taking care of patients, giving them medications, doing wound care. There's so many areas of nursing that you can go into. If you don't want to work taking care of patients, you can go into other fields like becoming a nurse educator, becoming an RN case manager such as myself. You can become a utilization review nurse. All of these nursing positions don't require you to be taking care of patients at the bedside. You're actually going to be working in an office in a different type of setting where you're not dealing with patient care, okay? So know that nursing is very broad and there's so many opportunities for you to work in various places, and you'll never get bored being an RN because there's different types of jobs that you can get into. You can become a travel nurse, you can become a labor and delivery nurse, you can become a pediatric nurse, you can be an nurse case manager where you're just primarily just coordinating patient care. You can become a nurse educator where you're educating patients about how to take care of themselves once they leave the hospital. You can educate patients on how to manage their diabetes at home. Not only that, you can become an advice nurse or a call nurse where somebody calls the hospital and they transfer that phone call to you so you can give a patient advice on whether they should come into the emergency department or they should stay at home and try to manage their symptoms at home. So there's many opportunities, guys, and becoming a registered nurse or an LVN is amazing. It's a great opportunity for you guys to really enjoy your job and not get bored. Because I know a lot of people in other fields of work, you know, sometimes after a few years of working in that same field, they get bored and there's no opportunities to go to a different place or work in a different setting. But as an RN, the options are limitless. All right, guys, so I hope this video helped you guys. Don't forget to like and subscribe to my channel. You can also follow me on Instagram at SASSRIZO5793. I'll also leave it on the description. Once again, that's at SASSRIZ as in zebra, 5793. You can follow me on Instagram and ask me a question directly if you're interested in doing that. But please don't forget to like and subscribe to my channel and let me know what other topics you want me to talk about. All right, guys, that was it from me. Love you guys and hope you guys have a great rest of your day. Bye-bye.